Welcome. Let's talk about fibroadenosis. What is fibrocystic disease of the breast or fibroadenosis? It is an aberration of the normal development and involution which goes by the name ANDI. Other synonym includes cystic hyperplasia, fibrocystic disease, memory dysplasia, chronic mastitis, and mastopathy. So what does it mean by fibroadenosis? Fibroadenosis is an aberration of the physiological changes that occur in the memory tissue at puberty, which is the evolution, and at the menopause involution, and characterized by cyclical proliferation and regression with lump, pain, cyst formation, etc. Pathology: cyst formation, which varies in size and contains dark mucous material. Fibrosis: increase in the fibrous tissue formation. Hyperplasia of the epithelium in ducts and acini. Papillomatosis: epithelial hyperplasia may lead to papillary projection in the acini. Incidence: the age is between menarche to menopause, but usually at 40 to 55 years. Unmarried children and women who do not breastfeed their children are common sufferers. Now, causes of ANDI. It is divided into endocrine and non-endocrine causes. The endocrine causes are due to disturbance of the hypothalamic pituitary gonadal steroidal axis with an increase in the circulatory hormone levels. The altered prolactin profile is responsible for the production of the galacturia in some cases. Non-endocrine cause includes use of the methylxanthines, stress, diet rich in saturated fat, altered essential fatty acid profile causes supersensitivity to normal levels of the estrogen and prolactin and iodine deficiency. Now, clinical features: premenstrual pain and tenderness, rural lesions in the breast, sizes of rice grains, firm inconsistency, and the lump is neither adherent to the pectoral fossa nor to the skin, serious or dark green discharge from the nipple occasionally, no nipple retraction, axillary nodes slightly enlarged and tender. Investigations: blood for TC, DC, and ESR, where there will be normal findings. Special investigations include mammography, which may help, biopsy, and histopathology to exclude cancer. Now, treatment: reassurance that it is not cancerous or precancerous, support to the breast with a firm brasserie, analgesics, and surgery can be done only for excision biopsy for the cure of the intractable pain. A some memory is excision followed by the prosthetic replacement. End of the topic.